Hello and welcome everybody. My name is Carrie Mighton and I am the clinical researcher and I do a lot of the editing and patient onboarding here with Tiaan and the Naturopathy Clinic. And today we're going to be holding a special presentation. This is the first of many educational videos and presentations that we are packing together for you. And we're going to specifically be talking about hormone imbalances. It's a hot topic, it's a big question, and there's a whole lot to cover. So basically, I just want to cover a couple of quick things before we bring Tiaan on. She's going to be helping us understand what's happening. I want to make sure that we don't waste your time, okay? So I want to, if you are someone who questions everything, that's actually a really good thing. But if you're not open to the idea of anything other than pharmaceutical drugs, or that's the only treatment option, then you're probably in the wrong place. We like to use a combination of working with doctors. We have doctors on our team, we have endocrinologists on our team, and we also do a lot of naturopathic medicine because we actually find a lot of the times by integrating naturopathic medicine, functional medicine, and general medicine, we get the best results at the same time. So if you are not open to those ideas, then please don't waste your time. You should probably just go now. This is also not for you if you're not willing to make any dietary changes in the future. Okay, the reason I mention it is because some of our patients have some really weird things that go on. It's not to say you can't ever have ice cream again, or you can't have a loaf of bread or a piece of bread or cake or biscuits. It's just that moving into treatment in your near future, you might have to do special sort of food combinations. You might have something weird pop up, like some of our patients can't have vegetables like mushrooms. Not saying that that's you, but some people have to make some dietary modifications because their bodies literally have fire, like inflammation sort of responses to specific types of nutrients. Okay, so if you're completely unwilling to make any nutritional changes or any dietary changes, then you probably would be wasting your time by listening to us, because that could be something that we eventually ask you to do. So best you not waste any more time. Okay, now this is for you if you really want to have more energy, you're willing to make some changes slowly. Okay, we're not asking you to make a whole lot of changes because that's really tricky, especially in the beginning. You're really keen to start feeling like your old self. You don't feel normal right now. You want to get a good night's sleep. You want to feel like you've got control of your health again. You want to get your body back. You want to figure out how to be in control of your weight, whether you're losing too much weight or all of a sudden you've got this brand new belly right around the middle that you don't like and you can't seem to shift. And you want to actually get answers to what's actually happening to you, rather than being told that you're just getting old or that your blood work is normal. So our goal today is really to help, and I'll be asking Tiaan lots of these questions. Our goal is really to help you get answers to what is going on, to what is very common, to what hormonal imbalances are, and we're going to go through all the different types of extremes of hormonal imbalances. So just to kind of give you some context on Tiaan before I bring her on, Tiaan actually was diagnosed with Hashimoto's, and she had to go to 4 different doctors just to be told that it was all in her head. She just needed to decrease her kilojoules, lose some weight, go on a low-fat diet, and basically, after researching and studying, she didn't really accept that. And at the 4th doctor, she was able to successfully get them to test her antibodies, her thyroid antibodies, and they actually realized she had Hashimoto's. So it wasn't all in her head. And with that diagnosis, she was actually able to put her Hashimoto's into remission, and she has successfully had a little beautiful boy. And she was also told that she would have a very difficult time getting pregnant or ever being pregnant because of her Hashimoto's diagnosis. She has successfully trained over 120 naturopaths across Australia and New Zealand. She's been personally mentored and onboarded by medical doctors like David Brownstein, Dr. Daryl Turner, and the Autism Clinic. She has specialties and certifications and diplomas in functional medicine. She has an advanced degree in naturopathic and herbal medicine, and she's also a nutritionist. She specializes in bacterial and gut treatment combined with hormonal treatment for endometriosis, peri-menopause, menopause, PCOS, infertility, thyroid conditions, and autoimmune conditions. And she also, as a result of having a sister who had autism and a mom who suffered from all the challenges around that. She has gone on to get further certifications and qualifications specifically to support children who are often affected by their moms who had, this hormonal or gut dysfunction. And she sees a lot of patients who have sensory and behavioral challenges using naturopathic medicine and is able to really support them. So without further ado, I'm going to bring Tiaan on. Tiaan will be here in just a second. So Tiaan, let me know when you pop on. I just want to share a little bit about our clinic, and then we're going to jump right in, okay? So the Naturopathy Clinic is an integrative medical team. We have a combination of naturopathic doctors, naturopathic practitioners, endocrinologists. We do functional pathology, gastrointestinal pathology. We use a lot of herbal medicine. We use bioidentical hormones, and we use a lot of nutrient intervention to support our patients to get the best results. We have clinical treatment across Australia, New Zealand, and the US. And between our doctors and our small team of practitioners, we have a combined experience of over 100 years. Tiaan, thank you so much for being with us today. I'm really excited to have you, especially someone with so much experience sharing all the things we talk about all the time with all of our different patients. So thank you for being here.
Thank you so much for having me here. I'm excited.
Awesome. So we're going to just jump right in, and we're going to go fast. I don't want to be fluffy. And I want to make the most of everybody's time. So before we get way too deep into our conversation, let's go through like a symptoms checklist, right? So if anybody's here today and they're not really sure if there's something wrong, or if people are here that have gone to the doctor and the doctor's saying everything normal, but they don't feel normal, which is more common.
Very common.
Let's talk about the symptoms.
Normally what I do in practice is, first of all, because I've been in practice for about 8 years now, and I would look at a patient, first of all, I'd think if they're between usually about the ages of 45 to 55, I'm always looking for the main symptoms of hormonal imbalances, which include things like weight gain or fluid retention, or both, lower energy, obviously changes in menstrual cycle, whether your cycles are becoming shorter, more irregular, heavier, more clotting, breast tenderness, changes in mood is a really, really strong symptom. Mood swings, depression, anxiety, thermostat changes, so waking up in the middle of the night being too hot, too cold, being more sensitive to warmer weather conditions or colder weather conditions. Joint pain, that's a big one. I don't actually think there's a lot of research with hormonal imbalances and joint pain or joint stiffness or muscle pain or muscle stiffness, but it's something I hear all the time in a lot of my 45 to 55-year-old women, and it's not something I've been able to find a lot of research on, but it's a very common symptom. Libido, that's a big one. That's a really big one. Changes to libido. It can be common for libido to drop quite significantly, but then increase a little bit 1 or 2 days before the menstrual cycle. That's a sign of a hormonal imbalance with the reproductive hormones. Hair fall, brittle hair, or dry skin is another sign of a hormonal imbalance. So your thyroid hormones can drop a very small percentage perimenopausally, which is directly associated with your adrenal hormones as well as your reproductive hormones. So that's a really important sign that we do look for as well. Also changes in appetite, so craving more sugars, salts is a sign of potentially imbalances in our insulin resistance, or our adrenal hormones as well. So they're the main things that I'm looking out for with my 45 to 55-year-old clientele.
I cannot believe how many women with endometriosis and PCOS are not getting diagnosed. Or the worst thing I've been hearing over the last couple of weeks, and it's gut-wrenching, is these women have been sitting on the waiting list, and because of COVID, it's been 2 years and they haven't had surgery yet.
Yeah. So my background, I studied medical science and naturopathic medicine, and throughout both realms, from the medical point of view and the naturopathic point of view, when we studied endometriosis, it was very much about hormones and a hormonal imbalance. But so much research has come out since I graduated that endometriosis is very, very, very much associated with gut health and the gut microbiome. So yes, our hormones are affected when it comes to endometriosis, but working and looking at symptoms associated with gut health is more than paramount, absolutely paramount. So patients come to me with endometriosis or suspected endometriosis, and again, like you said, it's gut-wrenching. A lot of patients come and their doctors are suspecting endometriosis, so they're given the pill just to mask their symptoms, and that's what they're given. That's what they're given to control their endometriosis. So signs and symptoms would include pain and excruciating pain. I'm going to talk to you about a case in a minute. This is a patient who has had a baby, so she knows what labour pain feels like, and she feels like she's in labour literally 25% of the year.
Wow.
Heavy, look, not everyone's a textbook, so the symptoms I'm about to say would not pertain to 100% of people, but I'm just going to go over the main ones. Really heavy periods, clotting, digestive discomfort. Pretty much all endometriosis patients would have diagnosis or suspected IBS, which is, a blanket term for digestive imbalances. So bloating, pain, intolerances to certain foods, potentially reflux, heartburn. Not so much irregular periods, but it can be irregular periods, and of course pain during sex, particularly at certain times of the month.
So I wanted to have a chat about one of our really lovely patients. Her name is Lauren, and I've asked Lauren for permission to share her story, and she was more than happy for us to share it. So Lauren was actually referred to us by one of our local doctors here, local to the clinic. We work with this doctor quite closely, so she sent Lauren to us. Lauren's got a diagnosed so she's been diagnosed with endometriosis, ADHD, and IBS. However, the main symptoms that were affecting the quality of her life were widespread pain and inflammation throughout all of her muscles, her joints. She had run lots and lots of tests. She had been to a rheumatologist. Everything came back completely clear. She had no diagnosed fibromyalgia or arthritis or anything like that, but she did have that widespread systemic pain and inflammation. Leading up to her period, she almost had, this is not diagnosed, but I'm sure she had PMDD. So she became extremely unstable in her mood. She's got 3 or 4 children, I think. She said it was just so unfair to her children. She would get them into so much trouble all the time. She would have massive fights with her husband, and then the pain due to the endometriosis of leading up to her period, and when her period first started, she said it was like child labour pains. It was like pushing out a baby again. It was just absolutely excruciating, and she was spending like more than 25% of her life, like half of every month, like half of the year, just dealing with endometriosis pain and symptoms and changes to her mood. So it was really quite debilitating and really quite sad on the family. So, and the other thing as well was her gut health. She was constantly uncomfortable, swinging between constipation and diarrhea.
And a lot of PCOS patients don't necessarily know that they have PCOS until they either go to get IVF or they hit 40 and all the resurgent stuff pops up.
So PCOS will include symptoms of irregular, painful periods, pain during sex, infertility. There's actually 4 different types of PCOS, and PCOS stands for polycystic ovarian syndrome, and not all of the types of PCOS actually have cysts on the ovaries. So it needs to go through a name change. So it doesn't necessarily mean there are going to be cysts on the ovaries. It's more something that we need to look at the hormones. Other symptoms could include, not in all types, but in most of the types, are hair on the chin, thickened hair on the arms, weight that goes around the middle. There's a very strong insulin resistance or blood sugar component to PCOS. So it's harder for our body to process and metabolize the carbohydrates and the sugars that we're eating. So literally all of the carbohydrates that are consumed, a little layer of fat can wrap around the molecule of carbohydrate, and so that's why we get that tire, that weight more so around the middle. Fatigue, issues with our thyroid, again, weight gain, mental fogginess, can't think straight. So it's just a whole cascade for all of our hormones when it comes to PCOS. Another common one we see are thyroid hormone imbalances. So common signs and symptoms of thyroid hormone imbalance in any age is weight gain, mental fogginess, can't think straight, hair's falling out, fatigued, exhausted, can't sleep properly, changes to our menstrual cycle, changes to our sleep. Another one that's really common as well is estrogen dominance. And we have a lot of patients who come to the clinic because they can't lose weight. They've tried every diet under the sun and they just can't lose weight. And if they've got high levels of estrogen, estrogen stores in fat tissue and it makes fat tissue break down really hard. So if you're eating properly and if you're exercising loads and you're not losing any weight, it's because that high level of estrogen prevents the fat breakdown. And symptoms will include period pain, clotting, breast tenderness, particularly when you're ovulating and before your menstrual cycle, fluid retention, having that glow, moodiness, particular PMS before your period, being either anxious, snappy. They're the main symptoms of menstrual clotting as well, of estrogen dominance. Yeah, okay, so we're seeing a lot of perimenopause, a lot of perimenopausal symptoms. And a lot of patients come to us because they're exhausted, they're gaining loads of weight, they're getting loads of hot flushes, they've got a lot of pain during sex, they've got absolutely no libido. They go to their doctor and their doctor will say to them, yeah, but you're going through menopause and you're getting older. But going through menopause and getting a little bit older is not actually a disease. It's a very normal transition of our hormones. So experiencing those symptoms are very common, but it's not actually normal. It is a sign that there are imbalances, and that's we can work with a lot of things like that.
So I really wanted to have a bit of a discussion about one of my patients. Her name is Carol. So Carol and I have been working together for about 6 months now. So Carol came to me. She had absolutely no diagnosed conditions. However, she has spent about the last approximately 15 years of her life after she had children really battling with the inability to lose weight, fatigue, digestive discomfort such as bloating, constipation, diarrhea, reflux. She had seen so many practitioners for the last 15 years. She felt like the last 15 years of her life, her whole entire world was just wrapped around trying to get healthy and trying to figure out what was going on with her. She was over 100 kilos, but she was trying to exercise every day. She was trying to go for walks. She had lots of different gym memberships over the past 15 years. She had tried lots of different diets. She had seen so many different practitioners, and she could hardly budge 1 or 2 kilos. So when she came to me, she was a little bit over 100 kilos. Her energy levels on a scale of 1 to 10, 10 out of 10 energy being fantastic, her energy levels were always like a 1 out of 10 or maximum a 3 out of 10. She was very bloated, very uncomfortable. She was always swinging between constipation, diarrhea. She had constant reflux, particularly at night time, which was affecting her sleep. And she had really bad fluid retention leading up to her menstrual cycle. She was very estrogen dominant. So she was experiencing a lot of fluid retention, a lot of breast tenderness, heavy periods, painful periods, quite PMSy. Her moods changed quite significantly before her menstrual cycle. So what we did, we sent her off for some further investigations. We did some further blood work to investigate a couple of different things, and we also did a stool test to have a look at what was going on with her microbiome. So one of the things that I had a very strong hunch what was going on with Carol was insulin resistance or blood sugar dysregulations or potentially diabetic or pre-diabetes. So we sent her off for further tests. We looked into her blood sugar profile, we looked into her thyroid hormones and her reproductive hormones, and we also did some basic bloods looking at vitamin D, iron, B12, full blood count, things like that. And a microbiome test looking at all the bacteria, the opportunistic bacteria, the beneficial bacteria, worms, parasites, inflammation, leaky gut, things like that with her microbiome. So we got all of her results back. So what her symptoms that she was experiencing for so long were actually quite significant insulin resistance. So she had a lot of insulin resistance. So I briefly want to explain what insulin resistance is, because when there's insulin resistance, it's so hard to lose weight. Basically what happens is naturally when we eat carbohydrates, our pancreas secretes a hormone called insulin. Insulin binds to every single molecule of carbohydrate that is consumed, and it carries it inside the cell, acts as like a little shuttle bus inside the cell, and then when the carbohydrate is inside the cell, it's utilized in the metabolic pathways and used up as energy. So what happens when there's insulin resistance is that cell is so full of carbohydrates already that insulin can't get any more carbohydrate inside the cell. So as a natural survival mechanism, a little layer of fat will wrap around the molecule of carbohydrate and store that for later use, particularly around the midsection. So it was really interesting that it did come back with insulin resistance. We were actually both quite pleased because this was probably one of the biggest reasons why she wasn't able to shift the weight, because the carbohydrate, every single molecule, like think about it, every single molecule of carbohydrate that was eaten, a layer of fat was wrapping around that, and it was just storing around the middle. And this is why over the last 15 years, she's just slowly just been getting a little bit bigger and bigger and bigger, because of that insulin, the issue going on with her pancreas and the insulin. So it was really good that we found that out, because it's something that we can treat. It's quite straightforward. There also came back her reproductive hormone, so insulin was quite dominant. So interestingly, when there is estrogen dominance, not only does your body store onto more fluid, but estrogen stores in fat tissue, and it makes fat tissue breakdown really hard. So when we are exercising, when we are eating pretty well, it does prevent fat burning. It does prevent fat breakdown. So it was really good that we picked that up as well. So, and she also had, with her gut microbiome, look, there was a little bit of dysbiosis going on, but there was also something called H. pylori. So H. pylori, it was really good we found this out. Symptoms of H. pylori do include bloating, discomfort, diarrhea, reflux. So, and that's something that we treated. It did take about 4 to 6 weeks to start to notice a difference with the reduction of the H. pylori, but that's something that she hasn't been struggling with since.
What does naturopathic medicine do differently than going to the doctor? Like, why are we able to actually help our patients versus going to other naturopaths or going to other doctors? Like, what makes us different?
So naturopathically, we will look at, work with and treat diagnosed conditions, but it's also really, really important that we are looking at the body as a whole and symptoms. I have a lot of respect for the medical industry. They're fantastic. They're absolutely fantastic for certain things, for life-threatening conditions. But when it comes to your symptoms, when it comes to hot flushes, changes to your mood, changes to your weight, your fluid retention, your libido, your joint pain, that's not a disease. You don't have a disease because you've got hot flushes. You don't have a disease because you're gaining weight. You don't have a disease because you've got joint pain, but naturopathically to us, they're symptoms. And they're symptoms to just say that something's out of balance. And naturopathically, and in our clinic, we want all of our patients to not just be disease-free, but to live life optimally with an abundance of energy, symptom-free, and prevent the risk of disease and conditions later on in the future.
So Tiaan, I totally hear what you're saying. And I know you mentioned a couple of stories. So I'd love if you could explain how you were able to work with Lauren and how you were able to work with Carol to actually use this process to get them better.
I've never met a patient with endometriosis who does not also have gut issues. Endometriosis is not actually a hormone condition. It's actually an inflammatory response stemming from the microbes and the bacteria in our gut. Now, science is now catching up, and there is a very, very strong link, and they've done lots of studies about this. The bacteria in our gut is responsible for every single disease and condition in our body, including things like endometriosis, including things like mental health, including things like the inability to lose weight. So I sent her off with some further stool testing, and we also started to really drive down those inflammatory pathways. We used specific herbs and specific nutrients and specific simple dietary measures off the back of that initial consultation to just start to work on driving down those inflammatory pathways. Then I got her back in for her report of findings. So we went over her test results. She had a reduction in that systemic pain and inflammation, which was fantastic. But just because she had the reduction in that pain and inflammation, it doesn't mean that the problem is fixed. There's a lot of work that we have to do before she can really walk away being completely healed. And she's there. She's almost there. It's been a few months now, and she's doing awesome. So when I went over her test results with her, she had an incredible amount of dysbiosis. So dysbiosis is basically just a fancy word for an imbalance in the bacteria in our gut. So it's when opportunistic bacteria, and I don't like to use the word bad because, look, there's bacteria, and it's only bad when it overgrows and moves to places where we don't want it. We actually want some of that opportunistic bacteria at a certain level. So it's very common in endometriosis because there's so much dysbiosis going on, there's so much inflammation going on that opportunistic down in the lower part of our gut can grow and move to places where we don't want it, and it can actually cause something that we often call, or that's known as SIBO, or small intestinal bacteria overgrowth. So SIBO is really, really common with endometriosis. I'm maybe not 100%, but close to 90 to 100% of our endometriosis patients would have some level of SIBO. So we needed to not muck around, and we needed to get together a really comprehensive treatment plan, because this lady, poor Lauren, she was in, like, not only was she in so much pain, it was like her moods and her mental health, it was breaking apart her family. Like, she was beside herself. Like, she logically knew, like, she wasn't herself. She really, really, really wasn't herself. And she was the most beautiful, kind-hearted, she's just got a heart of a lion. And to not be able to control your mood and your emotions, and to just be feeling that unstable mentally due to your physical condition, and antidepressants and mood stabilizers, they just weren't really helping her. In fact, if anything, they were making her feel numb and really significantly affecting her energy. So what we started to do is we started to work with gut health and the gut microbiome. So we initially started to weed out the opportunistic bacteria to reduce that inflammation, to reduce the inflammatory bacteria. So we worked on reducing the small intestinal bacteria overgrowth, and then we started to go into seal up the gut, reverse the leaky gut or gut permeability. So basically what leaky gut is, it's when the cells in our intestines become a little bit separated and leaky, and larger food particles that we're eating can actually get through those cells and into the bloodstream, and that can cause a whole host of symptoms. So the main symptoms of leaky gut do include things like changes to our mood, changes to our energy, headaches, skin issues, and digestive discomfort. And she had a significant amount of leaky gut going on. So we really had to seal up that gut, and that's going to help her, and that did help her to absorb more of the nutrients that she was eating as well. And get her nutrition and get the food that she was eating to nourish her and support her, rather than cause a whole cascading effect of an inflammatory response. So yeah, we started to work at healing the gut wall, reducing that SIBO, that small intestinal bacteria overgrowth. We did that through very specific herbal medicine, nutritional medicine, and dietary therapy as well. And we didn't test her reproductive hormones. And she came back. We had the appointment yesterday or the day before, and it was really exciting. She came back. So it took about 3 or 4 cycles, or it actually took about three menstrual cycles to go from feeling like she was having a baby to it being pretty painful, but not as bad. Then her last menstrual cycle, her symptoms were so mild. She wasn't experiencing the breast tenderness as much. She wasn't experiencing the heavy clotting periods that had completely dissipated, that had completely gone. But ultimately, her mood was excellent. Her mood was amazing. Like, she hadn't had any outbursts at the children. She hadn't had any more fights with her husband. She had so much positive energy and so much motivation. She runs a business. She owns a business. And yeah, so in terms of her mood, like almost, back to her old self. In terms of her endometriosis, now I just want to emphasize the fact that just because her mood is better, just because her endometriosis pain is better, and just because her gut health is better, it doesn't necessarily mean that we've fixed the problem. It's really hard to fix deep-seated problems like this in 3 months. It can take 6 months. It can potentially take, depending on how deep the wounds are with these conditions and these patients. It can take up to 6 to 12 months to really 100% reverse a condition such as SIBO, endometriosis, PCOS, thyroid conditions, things like that. But just like turning the corner and facing her in the direction of completely reversing these IBS type symptoms, these mental health issues, and the endometriosis is, so she's well on her way to recovery, it's so nice. And it's so nice to not only help an individual like this, but to also help a family. Which is incredible. So we've probably got about another month or 2 left of treatment together. So moving forward, our long-term goal is to 100% eradicate that dysbiosis, because we need to 100% eradicate that overgrowth of opportunistic bacteria, because if we don't 100% eradicate it, if there's still a little bit left, it can start to slowly proliferate and grow again. So that's our long-term goal. And to keep those inflammatory pathways down to, and her joint pain and her muscle pain, 100% gone. So we need to, keep working on that long-term, low inflammatory response, and and keep that gut health in check as well. So I really, really wanted to talk about Lauren, and I was really happy that she was happy for us to share her goals. The other thing as well, I did say we didn't do any reproductive hormone tests, but she definitely did have, she definitely was very estrogen dominant. So although we didn't do any testing into her reproductive hormones, all of those symptoms dissipated. So she became very non-estrogen dominant which was fantastic. So Carol came back 2 weeks later. So we had the initial appointment. I set her up on an initial treatment plan just to support symptomatic symptoms while we were waiting for her test results to investigate what was going on underneath. Now, she came back 2 weeks later. We went over the results. She said in that appointment that her energy was a fair bit better within that 2 weeks. So I gave her some specific herbal medicine, specific nutritional medicine as well to help lift up her energy levels. And she had started to see a reduction in the fertility or an improvement in her energy within about 2 weeks. I got her back 2 weeks later, so that's 4 weeks from the initial appointment. So 4 weeks after we started treatment, her energy level had gone from about a 1 to 3 out of 10 to a 7 out of 10, which was awesome. So she was feeling, I would say, significantly better in her energy within that first month, which was fantastic. Now, she had also lost about a kilo or 1.5 kilos within that first month, which was really good. So we were getting, we had only just started shifting things, just started working on her metabolic pathways. So that was fantastic. We had seen a little bit of a reduction there in her weight, which was awesome. She had a period a few weeks after the initial appointment or a few weeks after we started the protocol. And she noticed she still had the PMS type symptoms, but she did notice a reduction in the breast tenderness and the breast swelling. And then each month, so I'll just talk about her menstrual cycle for a little bit here. So each cycle, there was quite a significant improvement. So about now, it's been 6 months now. So from 6 months ago, where she was experiencing so much changes in her mood, PMS type symptoms, really bad fluid retention, really sore breasts, bloating, heavy periods, clotting periods, to 6 cycles later to almost 100% asymptomatic, which is great. And also no discomfort, no digestive discomfort before her period, which is awesome. Now, she's lost 15 kilos in 6 months, which is amazing. And the most exciting news is we've retested her insulin, and her blood sugar markers are 100% normal. So they're all exactly where we want to see them in the range. We can very, very safely say she's no longer insulin resistant, which is amazing, which is really good for her, because although we really want to support her to have great, healthy diet and lifestyle habits, like long-term habits to sustain her well into the future. It's also hard with insulin resistance because every single thing that you eat that's got any carbohydrates in there, it's just going to store as fat tissue. So she's now got a little bit more flexibility. So she's got a really, really good routine now with what she's eating. She's got a great routine with her exercise. The weight will continually go down a little bit. She's now about the approximately 85 kilo mark, and she still wants to lose a little bit more, but we are able to get a little bit more flexibility in her diet while she's losing weight. So that's super exciting. To be honest, we haven't retested her reproductive hormones. However, all of her estrogen dominant symptoms have completely dissipated, which is great. So no more breast tenderness, no more PMS before her menstrual cycle. Her rings aren't getting tight anymore. She's not experiencing any of the heavy periods, the clotting, which is great. So, that's all done and dusted. That's fantastic. We've really made a dent in her symptoms with her reproductive hormonal type symptoms. And then we've got the gut microbiome. So we still haven't retested the gut microbiome, and we will be. We will be doing that really soon. She's 100% asymptomatic, so meaning she has no symptoms anymore of the dysbiosis and the H. pylori, or otherwise known as Helicobacter pylori. She doesn't have any of those symptoms left. It can take longer though than 6 months to be double sure to make sure that we don't have any of that H. pylori present, and we have fixed and rectified what's going on in the gut microbiome, and if there was any leaky gut going on, that we have healed that leaky gut. So it can take longer, but in saying that, she doesn't have any of the symptoms anymore. So we'll probably do another one of those tests within about the next 1, 2, or 3 months to see to see what's going on there.
And do you work with doctors or?
Yeah, we work with doctors all the time, and we also work independently. So if we've got a patient, we're very, very happy to be part of a team of care for that particular patient. And like you said, a lot of patients come to us, they feel like they're not heard. They feel like because they don't have a diagnosed disease, their doctor fobs them off, and that's okay too. We don't need to work with their doctor. We also have a few doctors who we recommend and respect, and we can refer patients to a doctor who we like if they did need that extra level of care or medication. So what we would do is we would do a combination of what we can call symptomatic care as well as long-term solution-focused corrective care. So generally speaking, we'd have a patient in front of us with a whole list of symptoms and things going on, and we'd set them up with like a double-pronged approach. So we'd set them up with what can we do now to alleviate the symptoms, as well as what can we do now to further investigate what's actually going on underneath, and how can we build a long-term treatment plan, and what education can we build up around that to support you to rectify the underlying imbalances to prevent X, Y, Z disease or condition in the future, as well as prevent those symptoms from coming back. So yeah, we work symptomatically as well as correctively.
And how long does it typically take? And what are typically the layers of onions you peel back? So do you go straight for the symptoms? Do you go symptom, hormone, gut, root cause? Like, what are the layers that you go through?
So generally speaking, say someone's got fluid retention, weight gain, hot flushes, insomnia, and adrenal fatigue. We do see about energy improving within about the first 2 to 4 weeks. We see a reduction in hot flushes almost instantly. Almost herbal medicine, hands down, is incredible for hot flushes. We see a weight reduction of about 0.5 kilo of weight per week. However, when it comes to deeper things, when it comes to adrenal fatigue and thyroid conditions and full-on gut dysbiosis, which is basically a fancy word for imbalance in bacteria in our gut, or gut permeability, that could take 6 months to 2 years or 6 months to 18 months to reverse the damage that has been built up and manifested over years and years of manifesting that condition. But symptomatically, quite quickly.
So Tiaan, thank you so much for your time today. And thank you to all of those of you who have taken time today to watch the video, to listen to our presentation. And I hope that you got a lot of value from it. I hope that a lot of the information has ticked a lot of the boxes for you, because that's really our intention. We always seek first to help you understand and inform you of what's going on. And then obviously, if you do resonate with what we're doing, we would love to support you. So there's 2 ways that you can get in touch with us. We actually have an introductory consultation that we offer to you for free over the telephone. There's a link just below this video. Sometimes it's around the video depending upon what kind of device you're using. And you can actually click on that link and it'll take you directly into our calendar, where you can either connect with myself or Tiaan, and we do a full symptoms assessment, genetical assessment, and we go deeper on your symptoms to help you understand what could be going on with you. And then if it's something that you want our support with, we can look at organizing an actual initial consultation where we get the treatment started and we get you on track to feel better, like our patients Lauren and Carol we talked about here. The other option is if you just want to book right in, we can take you directly to our schedule where you can book in, and you can just go to our website link that will be just below this video as well, where you can actually take a moment and you can just go in, organize your deposit for the consultation and get started. One of the questions we get a lot of the time from our patients is how much is all this going to cost? What's the investment going to be? So I just thought I'd take a second to kind of walk you through the investment, because we want to be as transparent as possible in a lot of cases. And for me as a patient, I know, obviously money is a real important part of this. And I wasn't able to get what I needed just through nutrition or just through taking, drugs that the doctors gave me. So often one of the reasons our team uses nutrient remedies and herbal remedies, and if needed, we might need to go through the bioidentical hormone route, which those things do require a bit of an investment, right? So the initial consultation with us, we're currently running a special. It's typically $197, but we're doing a $30 off promotional discount. So you get that first consultation for $167. And then typically you will need some supplements, and we are conservative with our supplementation and our support. You're never going to leave with a $700 bill. That's not how we work. We give you the most important things that you need in the best dosage amounts to basically hopefully only have you with 2 or 3 items that you're taking at one time, okay? And then typically most of our patients see us for anywhere from 4 up until about 6 months, and we have packages and programs that we work with you on to help really keep your costs down with us. So if that's something you want to know more about, again, take the moment right now, book in an introductory consultation on our calendar. We usually spend about 30 minutes with you on the phone, sometimes 20 on that introductory call. And like I said, it's completely complimentary. So thank you again for your time today. I hope that this has been really helpful. We would love to support you. And we look forward to connecting with you again soon. Thanks so much, guys. We'll see you later. Bye-bye.